Aneurysms in the brain have been treated with surgery since the 1930s, but since the early 1990s, we can also treat them what's called with coiling. It's an endovascular technique similar to some of the techniques that you've heard about here before yesterday and today. But the tried and mainstay of treatment remains surgery. And the reason for that is that we know the long-term results of surgery. It's very easy to obtain short-term results. You just see if a patient survives the treatment. But what's really important are the long-term results. And we know that with clipping, once an aneurysm has been clipped, you really don't have to worry about the aneurysm ever coming back. So this is a picture of an aneurysm. It's what's called an angiogram of the brain. And again, this is this carotid artery. This is a lady from, I think, from Pomona who lost vision in her right eye. And you see here, there's another one of these giant aneurysms. And the nerves going to the eyes are right over here. And the aneurysm just sort of goes around it. And then we operated on it, and it's a little bit hard to tell, but we had to put 3 clips on it in order to sort of take that aneurysm away from the normal artery going to the brain. Now this is the other technique, the coiling, and what that involves is similar to any other type of transarterial technique. It's a puncture in the groin, and then the neuroradiologist, or sometimes now the neurosurgeon, will place the little pieces of metal, little platinum coils within the aneurysm, and then once those coils have been placed, we can detach that, and the metal is very thrombogenic, so little blood clot forms around the metal, and it seals off the aneurysm. So that's what you can see here on the left side. You see those 2 little bubbles sticking out of the artery. And then this patient did not undergo surgery. The reason I didn't want to operate on her was that where this aneurysm is located, if you want to do surgery, it's very involved. You have to take the orbit out, the eye socket, and the risk of the surgery is quite high. But fortunately, I think Dr. Maya did this embolization, as you can see on the right side. The aneurysm is completely gone. And I just saw this patient back about a month ago, 5 years from the coiling, and the aneurysms have not come back. Sometimes we have to do something a little bit more sophisticated than that. This is a patient I treated from Bakersfield who went to her regular doctor with a massive nosebleed. And as you can see here, there's another giant aneurysm, but it's a little bit lower down. It's not even really in the brain. It's behind the sinuses of the nose. And the aneurysm had eroded itself through the bone into the nasal cavities. And when the aneurysm ruptures, it just caused a massive amount of bleeding through the nose. And then what we did is we did 2 things. We first did a bypass. And, when most people talk about bypass surgery, they think about heart bypass surgery. But you also can do a brain bypass. And we mainly do that surgery for people who are at high risk of having a stroke. But sometimes we also do that to treat difficult aneurysms. And we take a vein from the leg, and then we sew it into the artery in the neck, the carotid artery, and then we sew it into the artery of the brain. And then here you can see this is this vein. So this is the 7th vein in the neck, and then this is where I sewed it into a brain artery. And then the way that we treat the giant aneurysm that had caused the bleeding is we had the radiologist just put these little pieces of metal within the aneurysm. This is just a picture of the surgery. And the sutures we have to use for this surgery are so tiny you can't really even see it with the naked eye. And that's what it looks like after the operation. So even though it says here what are the recommendations for screening, I don't really know if those are true recommendations, but I think that for those of you with a bicuspid aortic valve, it's something that you can consider. We know that the risk is about tenfold that of the general population, but that still means that there's a 90% chance that a person with a bicuspid aortic valve does not have an aneurysm. But if you do want to be screened, we wouldn't really recommend it for anybody under the age of 18, just because the chance of finding something in somebody that young is essentially zero. And we usually don't recommend screening in people over 70 here in this country. And then, because you're not born with an aneurysm, and it's really just something that comes on later in life, having a normal angiogram at some point in life doesn't really guarantee you from never getting an aneurysm. So in general, we recommend repeating the screening test every 10 years or so until you reach the age of 70.